Healthy habits for the spine. 1. Correct posture when lifting objects. Avoid lifting heavy objects whenever possible. If it is unavoidable, never lift an object. By bending your back while standing, you must develop the habit of keeping your back straight. Bending your knees and holding the object close to your body, even when picking up a single ballpoint. Pen dropped on the floor. Please make sure to bend your knees. Do not hold objects far from your body with your arms fully extended. Instead, bend your arms and hold the object close to your torso. And do not hold it for too long. Please be careful not to lift heavy objects above waist level. When lifting an object, turn to face it directly before lifting and never twist, or turn your lower back while lifting. When taking down or putting up an object in a high place, do not overexert yourself by standing on your tiptoes and stretching your back and arms. Please make sure to use a chair or a step stool to move the object safely. Make sure to distribute the weight of the objects into both hands. If that is not possible, alternate hands frequently. Be careful not to carry a bag on just one shoulder. Also, whenever possible, it is better to carry a load on your back rather than holding or carrying it in your arms. 2. Correct standing posture. The best posture when standing is to place one foot forward with your knees slightly bent. It is recommended to rest your feet alternately on a footrest, about the height of a single brick. Sticking your stomach out or slouching your back is not advisable. If you must stand without a footrest, please keep your back straight and your shoulders slightly relaxed, aligning your head, lower back, and buttocks in a straight line, and ensure your weight is distributed evenly across both legs. When you need to lean forward, do not just lean in or bend only your back and waist. Instead, you must bend your legs to lower your posture first and keep the forward bending of your torso to a minimum. Similarly, when working in the kitchen, washing your face, or brushing your teeth, bending one or both knees helps distribute your body weight, which is highly beneficial for the health of your lower back. Please avoid standing in the same position for extended periods of time. 3. How to sit correctly. You should avoid sitting with your legs extended for too long or sitting on the floor instead of a chair for extended periods. If it is unavoidable to sit on the floor without a chair, you must sit up straight with your back erect and your chin tucked slightly toward your chest. Be careful not to lean your upper body forward. Sitting cross-legged while placing both hands on your knees or thighs to support your upper body, raising one knee, or sitting with your back against a wall are all good ways to distribute your body weight. For chairs, a functional chair that supports your posture, or a slightly firm chair, is better than a comfortable swivel chair or one with overly soft cushions. It is not good for your spine if the chair is too high for your height, causing your heels to lift off the floor. The ideal chair height allows your thighs to be slightly higher than your buttocks, and please make sure to choose one with a backrest. It is recommended that the angle of the backrest be tilted slightly backward by about 10 degrees, rather than being strictly at a right angle. If you must sit on a chair with a completely straight backrest, it is advisable to place a cushion behind your lower back. Slouching, crossing your legs, sitting cross-legged in a chair, or sinking deeply into the seat are all poor sitting postures. Whenever possible, pull your chair close to the desk. Slide your buttocks all the way back and sit upright with your back straight and fully pressed against the backrest. Be careful not to drop your head too far down. And it is best to avoid stretching your legs straight out, which places excessive strain on your thighs. When sitting down in a chair, support your thighs with your hands as you bend your body to prevent your body weight from suddenly shifting to your lower back. Similarly, when standing up rather than rising abruptly, it is better to first slide your buttocks to the front edge of the chair, step one foot forward, and stand up without bending your waist. Please be careful not to sit with a wallet in your back pocket. You should also stand up occasionally to lightly stretch your upper body and lower back to relieve muscle fatigue and tension. Furthermore, please refrain from forcefully bending your back to pick up objects from the floor while remaining seated in your chair. For correct posture when driving, please be careful to avoid driving for long periods or driving with poor posture. Make sure to take a break every hour while driving. When sitting in the driver's seat, pull the seat forward so you do not have to reach too far for the steering wheel, and sit so that your hips and knees are in a straight line. It is advisable to tilt the backrest slightly backward by about 10 degrees, keeping it close to a right angle, leaning back diagonally or leaning your body forward, so that your back or buttocks lose contact with the backrest can easily cause lower back pain. Therefore, you must sit with proper posture by sliding your buttocks all the way back, so there is no empty space behind you. If you have a smaller body frame, please place a cushion or a rolled-up towel behind your lower back to bring your body slightly forward. Be careful that the angle of your knees does not exceed 140 degrees when driving or pressing the accelerator pedal. Please avoid adopting incorrect postures, such as resting one arm against the car window. 5. How to lie down correctly. Avoid sleeping on your stomach and be careful not to sleep on a surface that is either overly soft or excessively hard. Do not sleep in a cold environment, and please avoid sleeping with your arms raised above your head. It is recommended to sleep lying flat on your back, looking up at the ceiling, or lying on your side. When lying on your back, it is beneficial to place a pillow or cushion under your knees and ensure that the pillow for your head is not too high. If you sleep on your side, make sure to use a pillow of an appropriate height to keep your neck horizontal, and it is best to bend your knees and hips. Additionally, placing a cushion between your knees while sleeping can help prevent lower back pain. Getting out of bed suddenly can put a strain on your lower back. Therefore, rather than getting up all at once, it is better to develop the habit of rising slowly, while supporting yourself with one hand on the floor or bed and the other on a wall. Please be careful not to lie on your side for extended periods, while propping your head up with your hand. 6. Proper exercise methods. It is recommended that you exercise regularly every day, even if it is just a little bit. If you feel any strain on your lower back during exercise, you must stop immediately and take a rest. Even for exercises that are good for your body, do not aim for a large amount from the very beginning. It is advisable to gradually increase the intensity and duration as your body becomes accustomed to it. The best form of exercise is walking. If your lower back hurts easily even after walking just a short distance, please do not overexert yourself. Take your time, walk a little bit every day at a comfortable pace, and gradually increase the amount you walk. It is beneficial to gently loosen up your body through activities such as calisthenics, bare-handed gymnastics, or swimming. Suddenly twisting your body, forcefully or excessively bending and stretching are not recommended, as these movements can put unnecessary strain on your spine. 7. Other guidelines. Please avoid wearing shoes with worn-out heels or high heels. A slight heel of about 2 to 4 centimeters is both aesthetically pleasing and comfortable for your feet. When choosing shoes, please select a pair that fits well and provides good cushioning. Please avoid wearing overly tight clothing. However, wearing a lumbar support back brace is acceptable. Please ensure you do not wear the lumbar support while lying down and avoid wearing it for extended periods of time. Applying a moderate warm compress or taking a half bath in hot water is beneficial, as it can help relax and soften the muscles in your lower back. However, please be aware that if you have suffered an acute lower back sprain, applying a warm compress during the first 2 to 3 days may actually be detrimental. Please be careful not to forcefully crack or move your joints on your own, to the point of making a popping sound, without receiving an accurate diagnosis and treatment from an Oriental medical doctor. Please do not answer the phone by tilting your head and holding the receiver between your shoulder and neck. Please do not step on the lower back with your feet or press down on it with excessive force.